Hi, I'm Oliver Sharp, and this is Fresh Perspectives from AMP Recover, where we connect with thought leaders in healthcare to discuss their practice and trends in the industry. Today, I'm very excited to be joined by Dr. John Christoforetti from Texas Health Sports Medicine. Dr. Christoforetti, thanks for being here. How are you today?
Doing great. How are you?
I'm doing really well, thank you. Can you tell us a bit about your background and what drew you to the specialty of sports medicine?
I'm from Pittsburgh, Pennsylvania originally, and I had a background in martial arts and boxing. And those arts as a kid and then growing up through collegiate ranks in those areas make you pretty focused on body awareness and training. Truthfully, the calling to medicine was one for me that was a faith-based decision on how to make some impact, since I was fairly good at science and I really liked the movement of the human body from a performance perspective. So it fit pretty well. And I had some great opportunities through the educational process to meet people that were very inspiring in carrying out more than just a job definition of how you work. And they were in sports medicine. So, whether it was Jack Delahaye at Georgetown or Richard Hawkins or Stedman and Fellowship, Dr. Mass. These are people that just really inspired me and kept me going and made me want to keep doing everything that I could to sort of carry that baton one step further.
Excellent. What have you learned as a sports medicine specialist working with athletes at the highest level of sport as you try to inform your care of everyday patients that are just trying to get back to a high quality of everyday living?
Honestly, it was the Stedman Hawkins Clinic that showed me this in the Carolinas more than anything as a young person, which is really true today as we treat elites and regular people. Simply that all humans are human beings at the same level. And then once their functional demands are identified by them, the avenues and the throughputs of sports medicine, which really brings together to bear medical science from a surgical perspective on a rare occasion, but often is bringing together psychological, physical, as well as mental and spiritual aspects of recovery towards a goal, like being a soccer player, a football player. But it could also be, my goal is to ride my bike on the weekends, or my goal is to go hiking with my kids this summer in Colorado. And these are still functional goals. I'm able to go to a sports medicine based team, and they're already understanding that I need to do rehab. They're already there to understand that it's about the quality of my life. And I think that those are the three simplest things: is continuity of care in the outpatient setting, comprehensive attention to the quality of life demands of the patient. And then the third thing is that on the terms of the patient's demands, not on the terms of just for one particular study or other, like you might see in a trauma practice. So I think that those are the most integrative parts, and having the top level athletes there. I can't say that it's directly applicable, their needs to my needs as a regular guy, but I can say that the same skills our team uses day in and day out makes it really easy to take care of a regular, honest community member that just needs to get back to what they're doing.
Let's talk a bit about your team. You've got a great group there around you, highly involved in multiple research groups. Tell me a bit about the most recent study that had to do with using physical rehabilitation to potentially avoid surgery altogether.
Well, that's a great question. And that, you give us a chance to talk about our work, and you're very kind to do so. I think that it was really the work of Ryan McGovern, who is a PhD and certified athletic trainer that spent years with me in Pittsburgh and is here now as the head of research with us in Texas, who came to me and said, hey, when you're in your office, how do you know who needs surgery and who doesn't when it comes down to having hip labral tears and impingement? And I said, well, it's kind of a thing that I put together from what I learned from pitchers throwing in the shoulder, that I learned from Dr. Hawkins. And it's this thing we do where I have them do a single squat test, anyone that comes referred with labral tear, to see, do they have the coordination and balance that's there that we would expect them to be able to throw a ball? And I can test that right here. And he said, well, I'd like to see if you can really predict who's rehabable. Can we study that? And so we did study that. And what we learned is that both he and I, a skilled trainer and then just an orthopedic surgeon, could both look at the same squat test right there in my office and agree when someone passed and when someone failed. Once we published a study about this, we then knew, okay, what do we do? Ryan went and searched the world literature, and he said, these are the exercises that have any evidence at all, any evidence to them. And he put them together in an evidence set, and he published that. Then what he did was bring it back to our office, and we made it the standard of care for everybody that came referred to our referral center for labral tear. We said, if you got an MRI that says labral tear, if you don't pass this particular test, we want you to spend 6 weeks at home under the guidance of a remote therapist. Give us 6 weeks. We know you may have done some PT before, but let's give you every chance not to have surgery. And when we ran it through, lo and behold, we had a significant number of patients that actually didn't need to have the operation at that point. Now, some of them may in the future have chosen to have the surgery, but the prehabilitation, the rehabilitation became a part of the standard of what we do. And it was very responsible both to cost as well as to avoiding unnecessary procedures.
Well, congratulations on that publication. I know patients are always happy to avoid surgery when possible. Let's switch gears here a little bit and talk about COVID-19. This pandemic has really wreaked havoc across the healthcare industry, with orthopedics being affected as well. We've seen elective surgeries get shut down. How did that affect your practice? And now that elective surgeries are ramping back up, how have you changed your approach to post-operative care?
You know, the beauty of the way that we have done things, and again, I think this speaks back to your first question about how do elite athletes affect a regular practice. We've had so many patients over the years that have come from far away that then go back to their teams that we've really been already crafted to have very discreet, and every time they're on site with us, they needed to be on site. If they need to be there, great. If not, we've been using things like FaceTime and other unsecure communication modalities in the past. But when COVID came, it actually opened up our ability to use secure link communications with people. And we've been doing virtual visits throughout. That has been tremendously helpful for both preoperative and then interim postoperative care. And COVID really made that possible from a regulation standpoint, as well as from a technology standpoint. We are about our patients and their lifestyles. So, you know, we had to adapt our questions and we had to adapt our recovery programs to meet them where they live, so to speak. And I think that that's where the technologies of having worked with various teams, trainers from around the country in the 2000s prepared us a bit for it. But COVID was absolutely a throw into the cold water for the whole healthcare system. I'd love to say that it wasn't a total adjustment, but we've had to adjust to it. And I applaud our team for doing so, but I also would suggest that it's bravery of the families that come here and our staff for being willing to be in our offices throughout. So we never actually stopped seeing live patients, although we did put a hiatus to what we call non-necessary procedures for the month of April. So that was what we did.
You mentioned sports there again. I know you're involved with the MLS team there, FC Dallas. We've seen a recent return to sports across a number of different leagues, which is a welcome distraction during quarantine. Can you tell us what's involved in keeping these athletes healthy and providing a safe return to sport?
A lot of it is ironically a waiting game, because you're waiting for several parties involved to come together to make a policy that will balance the inability for us to actually prevent this infection transmission with that desire to get young athletes back to their prime and to their play and at their terms. So, you know, we and this is just not lip service. This is really what went on. What went on is debates at the levels that I would not be privy to, but there'll be debates inside the annals of the league itself, and then within the Players Association itself, and then at the local level within each local municipality where the stadiums exist. But, you know, suffice it to say, we started at professional soccer with a bubble, which meant we wanted everybody to go down to a certain area and have everybody be disease-free if possible. And then we've moved into an area now where we can watch on television that our team and others are playing live games, but there's a very rigorous testing that is going on. You're seeing the successes and failures of those policies play out in all the pro leagues right now. And, I think that there's been a lot of debate, but the elite athletic populations have been our fearless leaders on a number of societal issues right now. And, these are very young people to be doing this. And so they trust us, and we've had to be, And I would tell you that although I have had no hand in designing policy, we try our best to follow it to the letter that it comes through, and it is not necessarily always easy.
Well, as a fan, I certainly appreciate your efforts in getting them back onto the pitch. Thank you so much for being here today as well. Very interesting getting to talk to you. I know you're super busy there with a lot of moving parts.
It's been really an honor to speak with you, and also the team at AmperCover, and I think that it's really part of the future as solution. And so it's been an honor for me to be here.